Welcome to the Every Mom is an Athlete podcast, where we believe that motherhood is inherently athletic. I see you lifting car seats, chasing toddlers, and carrying groceries one-handed while holding a baby and a coffee. Your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, entrepreneur, and mom of three. Here you'll find solo episodes and real conversations with other moms and leading experts, so you can live your strongest, healthiest, most aligned life in motherhood. No matter how long it's been since you've had your baby, whether you're reconnecting with your body, rebuilding your strength, or just figuring out what feels good again, you're in the right place. Hello, and welcome back to Every Mom is an Athlete. Today, we are going to be talking about how to find a chiropractor while you're pregnant and why you should see a chiropractor when you're pregnant. If you're not pregnant and you're wondering about chiropractic care and if it's right for you, check out last week's episode. That is all about just in general how to find a good chiropractor and what I recommend, like the certifications, the questions you want to ask, all that kind of stuff. So check out that episode too. But if you're pregnant, this is the episode for you. So by the end, what I'm hoping you guys will know is exactly the questions to ask, what red flags you can look for, how to find a chiropractor that's going to be a good fit for you, and how to feel confident in that decision. So let's get into it. Obviously, I am a chiropractor. I've been a chiropractor for almost 15 years now. And when I started off, I really did specialize in sports, in athletic injuries. So I started my own practice in a CrossFit gym, which was really fun. I saw a lot of shoulder injuries, a lot of just regular back injuries, a lot of people who wanted to just optimize their movement and their health and their wellness, which was also really fun to do. And then as I progressed kind of through my practice through the years, and as I started to think about having kids of my own, I really got interested in pregnancy and postpartum care. And it has been so fun for me. I love it. It's so rewarding to be able to help pregnant women, especially because it's just such a vulnerable, hard time. And your body is going through so many changes. And it truly is, as a chiropractor with the right training, it truly is so easy to help pregnant women, because if you think about it, the joints, the ligaments, the tendons, everything is moving so easily. And so that's great. Like that makes it really easy for me to adjust them. It also means that you need some special support and help during that time to stabilize those joints after we get things moving well. So I have found that for pregnant patients, chiropractic care, the right type of chiropractic care, is just incredibly beneficial and can just really make the world of difference as far as how much you really enjoy your pregnancy. Because if you are in so much pain, I go off on a soapbox about this all the time, so forgive me, I'm going to do it again. But you're not supposed to be in pain during pregnancy. Yes, like little aches and discomforts and changes are totally normal. You are growing a human, your body's changing so much. But when you're in pain to the point where, like some people, seriously, like can't get out of bed without pain, can't get up to go to the bathroom or sit down on the toilet or even go for a walk without severe pain, that is not normal, and there is help for it. So today I want to talk about some of what that help is, what it can look like, and how it can be beneficial for you during pregnancy. So reasons that you might want to see a chiropractor, right? So obviously low back pain, pelvis pain, sciatica, pubic bone pain. A lot of times people don't think about the pubic bone, but it's connected actually in the back where your SI or your sacroiliac joints are. So those like little dimples in your back, that is like part of the big pelvis bone that wraps all the way around and attaches in this little tiny part, which is your pubic bone on the front. And so that bone is actually bearing a lot of weight, right? Because your pelvic floor attaches in there, and then your abs attach up at your ribs and then come all the way down. And they attach also, the tendon kind of attaches into that pubic bone. So you can imagine as your abdomen is stretching, those abdominal muscles are going to pull on that pubic bone. So it can just like get shifted. It can cause a lot of pain. You hear people talk about symphysis pubic dysfunction or pubic bone pain. That's another great reason to get into a chiropractor. It also can just help with posture. Lots of times people's upper back and ribs, I can't tell you, actually rib pain is one of the most common things that I see as far as complaints in my office for pregnant patients. And a lot of times people don't think about that. But again, remember, those abdominal muscles are attached to the ribs in the front. And then your back is just getting so pulled forward, kind of rounded forward as your chest is getting bigger, the belly's getting bigger. So that's also a really common complaint. So all of those are things that a chiropractor can help with. And I'm going to give you a shameless plug here, but I do have an at-home fix your hip and pelvic pain during pregnancy and postpartum plan as well. So if you can't find someone in your area, of course, I always recommend trying to get in to see someone first. But if you can't, I do have a plan at home that you can check out. It's like $74 or $79, can't remember, but way less than a visit with me costs. And I give you all the tools to work on these at home. So all those things, sciatica, pubic bone pain, low back pain, all those things. I give you ways, exercises to help fix it, stretches, and even like a way to realign your pelvis that you can have your partner help you with at home, which is really similar to the way I do it in the office. So anyways, if you're not able to get in to see someone, check that out. It's on my website. I'll link it below. Okay, let's talk about a couple of myths that I sometimes hear from people, especially about seeing a chiropractor during pregnancy. So the first one is that it's not safe to get adjusted during pregnancy. And this is just straight up not true. I would hope, and I think, at least in my area, this is not as common of a myth anymore, just because I see OBs, midwives, physical therapists, chiropractors. I see us working all so much closer together than we used to. We used to be all like, chiropractors and PTs especially. We're like at odds. It's my experience that we work really closely together. I'm sure that's not the case everywhere, but that's my experience. So this just isn't true. It is safe, especially with the right training. What you want to do is see a Webster provider, and I'm going to go into that more in a minute. But that's just a really gentle technique that's going to use what's called the drop table. So we're not like twisting you up and like cracking everything. It's a really gentle way to adjust your pelvis and get things moving better. And like I said, this can reduce a lot of pain and it can help with alignment, which can help your baby get into a better position. And that sort of brings me to myth 2, which is one of the myths is that a chiropractor can help flip a breech baby or can flip a breech baby. And this comes from Webster technique and babies actually flipping on their own once the pelvis is aligned in a way that gives them optimal room, right? So imagine, if you grab your 2 hip bones, think of one like really rotating forward and one really rotating back. And that's really going to put your pelvis at this like kind of oblique position where it might be really hard for baby to get into a head down position. So what most midwives and OBs, if they find out that baby is breech, they'll have you get into a provider, a chiropractor who's Webster certified. And in that case, you will see that provider pretty often. As we go on here, I'm going to talk about what a good treatment plan should look like and like how often you should be getting in to see a chiropractor during your pregnancy. But in this case, I'll say that it's really common that you would go in multiple days in a row, multiple times a week, just for that specific reason that you're trying to get the pelvis to be completely perfectly aligned and allow that baby to get into a good head down position because they have enough room. So the chiropractor does not flip your baby, but we can allow your pelvis to get into a position where that baby can flip on its own because now it has enough room. That's not always the case, right? Like of course, I got chiropractic care by a Webster provider my entire pregnancies, all of them. But my second one, my son was breech and he just was not moving, even though I had care the whole time. So sometimes babies are meant to be breech and you're not going to change them no matter what. But if it's because of a hip misalignment, that can be super helpful. Another myth that I've heard before is that you can't lie on your stomach, so you can't get adjusted at a chiropractor's. And again, that's just not true. Any chiropractor who's trained in pregnancy care is going to have pregnancy pillows. And what those are, they're just lovely, by the way. They allow you to lay on your stomach. And I actually have 2. So one is when you're just newly pregnant, usually that first, second trimester, kind of into this middle of the second trimester, which is like a little hole for your belly to go in. And then as you get bigger, I have 2 that you can another one you can stack on top. So your belly really can be comfortable in that hole and you can be on your back. And that actually is so relieving. Most of my pregnant patients say it just feels so good and so nice to be on their stomach for a little bit. And that's actually how I would check your pelvis to do Webster technique is on your stomach. So it's really common to be on your stomach at the chiropractor while you're pregnant. But of course, we have to have those pregnancy pillows, right? So let's switch gears a little bit and talk about what to look for. So I mentioned Webster technique. The way that you can find that is the ICPA, which is the International Chiropractic Pediatric Association. So they have a website that has all the providers listed. So you're looking for a Webster certified provider. And again, Webster is just a technique that we learn. I learned it after I went to chiropractic school. It also makes sure that provider not just knows how to do the technique, but that they also really understand a pregnant woman's body, the different trimesters, how the body's changing, what the hormone situation looks like, all these things and how that's like affecting your joints and ligaments and tendons and just like all the pieces that we need to understand about pregnancy, and we know how to adjust you. So it's really like a lot more than just the being able to adjust you, right? It's really understanding a pregnant woman's body. The other thing I try to recommend, if you can find someone with multiple credentials, so if you can also find someone who does active release technique or is a sports chiropractor, which would be like CCSP, that's Certified Chiropractic Sports Physician, or CSCS, which is a Certified Strength and Conditioning Specialist, which, by the way, I am all of those things. So that's one reason why I recommend finding someone that does Webster and at least one of these other certifications, because that just means that they're going to have more experience working with the whole body. So working with the muscles, the ligaments, the tendons, being able to give you good rehab and not just necessarily adjusting you and sending you on your way. So if you can find someone that is Webster Technique certified and has some of those credentials, that's even better in my opinion. It's just going to allow them to look at you with a little more well-rounded approach. I also just always recommend, people are really funny. Like everyone who loves their chiropractor, like loves their chiropractor. And it doesn't necessarily mean that like they are getting the very best care, to be honest. You want to get people's opinions, like your friends, you can ask who they see, who they like, if they like their chiropractor. But I would just also do the research online because sometimes people don't know what they don't know. And yes, there's a place and a time to just go in and get adjusted. But I just think during this time of pregnancy, you really need this specialized care. So even if someone's like, I love my chiropractor, you have to see them, just do a little research to make sure that they're comfortable seeing pregnant patients and that they really often like see pregnant patients, that it's a big part of their practice. The other thing you can do is look for someone who also sees babies. I do see babies in my office. It's not like my primary patient source, but there are chiropractors out there that like basically just see moms and babies. I'll have to do a whole nother episode on that sometime because chiropractic care for babies can be so beneficial to help with nursing, to help with colic, to help with torticollis, which is sometimes their heads get stuck in a position, kind of rotated to the side, and they need assistance with that. But also just sometimes the way that the baby comes out, the tractioning of their spine. So birth is, it's a pretty intense process. So I'll have to do another episode on that sometime. But there are chiropractors that do see babies. It's really fun to see babies actually because it's so, so gentle. Their little bodies just respond. There's no cracking. You're just literally like kind of holding the joints where you can feel they need to move. And then you just like feel the joint like move and like melt away from your hands. It's wild. So anyways, I digress. So as far as red flags to watch out for, again, I sort of already mentioned, but you want to make sure that they have prenatal and pregnancy and postpartum training. You want to make sure that they are Webster certified. You want to make sure that they're not making like crazy promises or guarantees, over promising things like guaranteeing an easier labor or that the baby's going to flip if it's breech or any of those things. Like, I can't imagine people doing that, but you just never know. Can labor be easier because you've seen a chiropractor through your pregnancy and your pelvis is nice and aligned? For sure, right? Like I liken it to if you're training for a marathon, you are preparing your body in this way for this race, right? And giving birth is no different. Like it's one of the most, arguably the most athletic thing you might do in your life. And so you want to be prepared for it, be training for it, make sure that your body is in optimal position. And so that you're not worried about, oh, my pubic bone hurts, my hip hurts, my back hurts, whatever, when you're like going into labor and like trying to deliver a baby. You've already got enough stuff to worry about. So I don't want you having to worry about your body when you're focusing on delivering that baby. Other red flags, I would just say disregarding your comfort or your concerns, obviously always a red flag with a healthcare provider. You want to feel like they're listening to you, like they're understanding you. And if there's something you're uncomfortable with, that they're listening and that they are accepting of that, right? So let's say, for example, you go in and you're like, oh, I'm really like, I don't know about my neck. I feel a little nervous about getting my neck adjusted. That should not be a problem. As a chiropractor, I have tons of ways that I can help your like whole spine be in alignment, working well, and, make things less painful without adjusting you. So we have other manual techniques we can do as far as like muscle work, working on the muscles, loosening certain muscles. We have little tools we can use to get the joints to move without having to quote unquote crack your bones. Okay. So just make sure that if you have concerns, like you're like, I really want this pelvis aligned. I want to make sure that I'm like ready for birth, but I really don't want my neck touched. That is your choice. And you can totally voice that and feel confident that if you're with the right provider, they're going to be okay with that. And they might try to tell you about some other options of ways that they can get it moving without doing that, but they should never try to force you into having something done that you don't feel comfortable with, obviously. So just, sometimes people get in there though, and they like forget that you're the boss. You're the boss of your healthcare in all situations. So just keep that in mind in that situation too. Like you can say, oh, I don't want that done, or I'm not comfortable with that, or whatever. Always use your voice. Well, I think that's all I have to say about chiropractic care during pregnancy. I know this is a little short and sweet episode, but I hope that's helpful. If you have questions, always feel free to reach out. I'm probably easiest to get a hold of on Instagram. Just shoot me a message there at Dr. Karlie. And I hope this gives you some confidence to be able to find a chiropractor during pregnancy and just have a better, more enjoyable pregnancy because your body feels better. You're not worrying about your neck hurting, your upper back hurting, your hips, your pubic bone, your pelvis, all these things. There are tools and ways that can help you to feel more like yourself and to move better and be more comfortable. So I hope that helps. If you know a mom who's pregnant, please share this episode with her. I just so hate for people to be in pain during pregnancy. And remember, you are doing amazing. I am cheering you on through every step of this motherhood journey. I'll see you next week. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder. Motherhood is athletic, and you're still the athlete you've always been. But it's not about going back. It's about moving forward intentionally and powerfully. If this episode resonated with you, I'd so appreciate it if you'd share it with a friend, leave a quick review, or rate the show. It helps more moms to hear what they need to believe, that every mom is an athlete. See you next time.